So, hello everyone, and welcome to today's webinar, day 3 by Homeopathy 360 and ISIA. Today is the third day of webinar series to understand the secrets of clinical homeopathy. I, Dr. Yashika Arora, heartily welcome you all to the session of today. A very warm afternoon to all of you. I will be the moderator of today's session for all of you. And I feel privileged enough to introduce the speakers of today. We have great speakers from different areas of the country with us today. And before we begin, I would like to introduce you to BJN's online education platform of Homeopathy 360, as well as the association ISIA, All India Homeopathic Youth and Students Association. Homeopathy 360 is one of the most updated portal of online publication of all kinds of course material for students as well as practitioners. Latest news, latest events, webinars, job vacancies, career opportunities, articles from great classical and contemporary practitioners, journals like Homeopathic Heritage, Homeobuzz, videos, and Homeopathy 360 is a platform which is trying to connect homeopaths worldwide and broadcast their talent to all over the fraternity. It has been an exceptional education hub for each generation of homeopaths, whether he's a clinician, whether he's a researcher or an academician. We try to organize each and every single information related to homeopathy and make it universally accessible at www.homeopathy360.com. Plus, during this lockdown period, we have started these webinars just to update everybody about about different aspects of homeopathy and create knowledge about homeopathy to the mass as well as students as well as practitioners. So also on behalf of my team, I would like to invite all the esteemed homeopaths who are present with us right now to contribute your knowledge and experiences in the core area of your expertise. For that, you can mail me at yashika@homeopathy360.com. You can get articles published, your videos, your presentations, anything you want to publish on the website. Let us know. Also, I would like to introduce you to the Association of All India Homeopathic Students and Youth Association, AHISIA. The association is based on Kolkata and it's a national platform of Indian homeopaths who is working to raise the standards of homeopathic education and practice in India. They are serving the Homeopathic Society by awarding the benefits of homeopathic system of treatment to the public, especially the low socioeconomic groups, by conducting regular camps, as well as they are fighting to maintain the honor and dignity of the profession. They are conducting regular conferences, seminars, various competitions, and publishing magazines. They are working hard to improve the quality of homeopathic medical practice as well as abolition of fake homeopathic practices. So we are thankful to AHISIA Group to collaborate with us in this series, in the 5-day series of Homeopathy 360 to understand the secrets of clinical homeopathy. Also, I'm thankful to Dr. Sen as well as Mr. Manish Jain for organizing such a series for the practitioners as well as homeopathic students. So now it's high time that I should introduce you to the speakers of today. And we have two great speakers. First of all, we have Dr. Professor Mrs. Zehra Faizan Haq, ma'am. She is MD in Homeopathic Repertory and head of the Department of Pathology Department and Antarbharati Homeopathic Medical College, Dabha, Nagpur. She is a consultant homeopath at Dr. Huck's Homeopathy, Nagpur. As well as, if you talk about her journey, she has passed BHMS from DS Homeopathic Medical College, Pune, and MD from A.H.M.C, Beed. She is honors in physiology as well as working as an examiner, paper setter, paper valuer at MUHS. So I welcome her on behalf of our team of Homeopathy 360 as well as AHISIA. She will be discussing on role of miraculous homeopathic medicines in treating arthritis, wherein she will be discussing the glide path complications, therapeutics, and top-ranking remedies for arthritis. We have another speaker with us who have been associated with us since long during these webinars, Professor Dr. Akhilesh Khan sir, erstwhile administrator, principal, head of the postgraduate department of D&D Homeopathic Medical College and Hospital, Government of West Bengal, and erstwhile member secretary, Central Selection Committee, AYUSH, Department of Health and Family Welfare, Government of West Bengal. He is presently working as Professor Emeritus, A.H.M.C, Nagpur, Maharashtra. He'll be discussing on heterogenic disease and scope of homeopathy, wherein he'll be discussing the rational approach for tackling the iatrogenic diseases as per the direction of available text of homeopathy. So I welcome both of them to the platform, and I am highly obliged to them for being with us today. I hope everybody is excited to learn from both of them. So first of all, we have the speaker, Dr. Zehra, ma'am. So I hand over the session to you, ma'am. Over to you.
Yes. Good afternoon, everyone. Good afternoon, everyone. First of all, I want to thank the team, BGen Publishers, and especially Manish Jain sir for inviting me on such a nice platform to share my knowledge, because sharing knowledge is gaining knowledge. So today, I will be thanking once again to the BGen team, and I'll be starting my webinar, which will be titled as Role of Miraculous Homeopathic Medicines in Treating Arthritis. There's no need of giving my intro, as Dr. Yashika ma'am has introduced me very fabulously. So we'll be directly starting a seminar with a great salute to our Master Hahnemann, who has given us this miraculous science, that is homeopathy. Homeopathy is a great science that deals with the suffering of humanity, and the simia similibus curantur, like cures like. So I want to say that Hahnemann has gifted us such a nice science that we are very lucky to be homeopaths. We are helping the persons to be relief of the suffering. So a great salute to our Master Hahnemann. All of you should salute. Yes. So today our webinar is based specially on the disease which is very disabling, that is arthritis. Now the question arises, what is arthritis? Arthritis is an inflammation of the joints. It can affect one joint or multiple joints. There are more than 100 different joints in our body. You know, arthritis makes the patient so disabled that the person is unable to perform the day-to-day routine work. The patient becomes so disabled and depressed that he becomes weary of life. So it is a very disabling disease, arthritis. And commonly there are two types of arthritis. One is osteoarthritis and other is the rheumatoid arthritis. Now, what are the signs and symptoms of arthritis? There will be severe joint pains, stiffness in the joints, swelling and edema, and all these symptoms will make the patient limp. Their gait also changes. They have tottering gait, and along with the main joint symptoms, there will be many other systemic symptoms. There can be depression, there can be anxiety, there can be fatigue, malaise, muscle pains. All that will be included in signs and symptoms of arthritis, thus making the patient disabled. Now, what are the etiological factors? Means, what is the position behind the arthritis? So, we have seen that there are two types of arthritis. One is rheumatoid arthritis and other is the osteoarthritis. So, in rheumatoid arthritis, it is an autoimmune disease. It is a self-inflicted disease. So, rheumatoid arthritis is usually genetic. Osteoarthritis is also genetic, genetic. In osteoarthritis also there is a genetic factor, but rheumatoid arthritis is more disabling due to the deformities formed by it. So many etiological factors can be there: stress. Then in osteoarthritis there can be overuse of the joints. Obesity is one of the main factor, because in obesity the joints have to carry more weight, and so they become osteoarthrized. So etiological factors have to be prominently linked with in rheumatoid arthritis, completely related to genetic. Now, what are the types of arthritis? First will be osteoarthritis. Second will be rheumatoid arthritis, which are the main commonly found. Third is the gout, ankylosing spondylitis, and psoriatic arthritis. So osteoarthritis, we have seen, it will be according to the age and due to the overuse of the joints, and also due to overweight. Rheumatoid arthritis will be genetic, and it is an autoimmune disease. And gout especially affects the small joints, and it is due to the defective purine metabolism. Gout. In gout, we'll see uric acid crystal formation in the joints, and thus we can see deformities in the joints due to the uric acid crystals. So these are the types of arthritis. Mainly we are going to deal with osteoarthritis and rheumatoid arthritis. Now, as we have discussed a bit before, that what is osteoarthritis? Osteoarthritis is a disabling disease, where the joints will be deformed from the normal. And one more thing you will see in osteoarthritis, that those who are obese, they will suffer from osteoarthritis later in the later life. When they will be aged, they will suffer from osteoarthritis because of the overweight. And many a times we see that due to the overuse of the joint also, many people suffer from osteoarthritis. So we can see here clearly, see the difference between the healthy joint and the osteoarthritis joint. You can see the wear and tear has taken place in the joint. The joint has totally deformed, and that causes pain. All this deformity in the joint will cause pain, severe pain. So it is controlled by painkillers and all, but it is not totally cured. That's why we have very good miraculous homeopathic remedies to treat all these joint diseases. Now we'll be jumping for the disease, a dreaded disease, you can say, that is rheumatoid arthritis. It is a very dreaded disease, and what you can say, it will make the life of the patient limp. The patient is unable to carry on the job, the patient is unable to walk, the gait changes, all the joints get deformed. Slowly, as the disease advances without treatment, if the treatment is taken properly at earlier stage, the deformities can be prevented. But when the disease is neglected, means what patients do, they say that vat rog ho gaya hai. What is this vat rog? They will not treat it. They will think that they are habitual, it is hereditary. They think that it is genetic. It is said that and it is genetic. Rheumatoid is also genetic, and osteo is also genetic. So what the patient do, they just take it as a habitual. Okay, it is genetic, so my mother was suffering, so I will suffer. So what they do, they don't take proper treatment, and slowly all the joints get deformed. There are irreversible deformity that cannot be reversed by any medicine, or that cannot be reversed by any physiotherapy or any massages. So rheumatoid arthritis is a disease that has to be taken seriously, and it has to be treated seriously, so that permanent deformities should be avoided. So rheumatoid arthritis will affect small joints, as well as it will affect the large joints. And the main thing is that it will mainly affect the fingers and toes commonly. They will get deformed totally. We'll see in the next slides how the deformities of rheumatoid arthritis occurs. So rheumatoid arthritis, we have seen that it is an autoimmune disease, self-inflicted disease. That's why it is more dangerous. Yes, here you can see clearly a rheumatoid arthritis hand. Yes, you can see particular deformities. We find many deformities in this. You might have studied all the doctors and all the great doctors who are observing today's webinar and all the students who are observing. They might be knowing these deformities. The hands are totally deformed in rheumatoid arthritis. We can see various deformities in it. We can see Bottonier's deformity. We can see Z deformity. We can see piano key deformity. Varieties of deformities are there. So what happens? Slowly, as the age advances, and the disease will also advance, if untreated in proper time, it will lead to particular deformities, which we are going to observe. And later on, we will see more slides of the deformities. And one more thing is that there is severe pain in all these tarsals, metatarsals, and carpals, and wrist joints especially. The patient is unable to perform day-to-day work. The patient is unable to cut vegetables. The patient is unable to cook food. Patient is unable to write. Patient is unable to do signatures. Such is the what you can say deformities of rheumatoid arthritis that will disable a patient. And due to all these disabling factors, the patient will become depressed. There will be loathing of life. There will be loss of love of life. And you have to treat these what you can say joint symptoms along with the mental symptoms of the patient. That for this thing, homeopathy is best for arthritis and rheumatoid arthritis, because in homeopathy we consider mental symptoms as well as physical generals. We lay more stress on the mental symptoms of the patient. So if the patient will be mentally calm, naturally his physical disease will reduce, naturally his physical symptoms will reduce. So as in other pathies, what we do, we reduce the pain by giving the painkillers and all. But in homeopathy, we consider the patient as a whole, because homeopathy works on dynamic plane. That's why homeopathy is very best for connective tissue disorders as well as joint disorders, because they are very disabling. Now you can see the difference between both the arthritis. So what is the difference between both the arthritis? First and foremost, in the rheumatoid, the metacarpals will be affected. In this, the distal phalangeal joints will be affected. And one more thing I can say you, that in rheumatoid arthritis, usually it is found that it is associated with gout. Usually when a patient comes to us for consultation, we do the rheumatoid factor test, and in rheumatoid factor test is positive. Sometimes what happens, the patient complains, in spite of giving the medicines, the patient complains of pain in the fingers and toes and feet. So one query should arise in the mind that about the uric acid. So you should set the patient to test the uric acid level. When the uric acid level is raised, you should conclude that rheumatoid is associated with uric acid. Usually I found in the patients that always rheumatoid is associated with gout. So whenever a patient will consult you relating to rheumatoid arthritis, do the uric acid level test, because in majority of cases I have seen that the uric acid increases, purine metabolism disturbs in rheumatoid arthritis. So nodules will be found in osteo frequently, and uh, it is absent in rheumatoid. This is the main complaint which a patient complains us. What they say, छोटी छोटी गांठ फील होती है joints के आजू बाजू में. So what is that? That is osteoarthritis. From that only we must diagnose that it is osteoarthritis. The patient feels small nodules in the near to the joint. So what are they? They are Herbedens nodules. So such is the difference between rheumatoid arthritis and osteoarthritis. And more thing is that when a patient consults us, our mind should not be in dilemma that whether the joint, when a patient consults us with joint affections, he says, my joints are paining, I have stiffness, morning stiffness. Then patient will say that I feel better by hot application, or I feel better by massaging, magnetized. The patient feels better by magnetism. So when the patient says like this, first and foremost, in our mind, all these three diseases will come. That is rheumatoid arthritis, osteoarthritis, and gout. But you should not keep a dilemma that which one is the final diagnosis. For this to diagnose properly, two subjects are very important in your study of homeopathic medicines. That is, first one is the pathology in the second year, in which you will study the diseases. What is taught in pathology? That the person is dis-ease, means he is not at ease. So in that you should study properly the disease, what is rheumatoid arthritis, and when you will go in final year, you will be dealing with the subject medicine, in which you will come to know how to diagnose a disease, how to come at a probable diagnosis, how to come at a particular diagnosis. So it is very necessary that you should have mastery in these two subjects. First is the pathology, and second is the medicine of the final year. These together, if you have mastery over these two subjects, you will become a good doctor, because you will be able to diagnose a disease very early. So you should be able to diagnose whether it is gout, whether it is rheumatoid arthritis, or whether it is osteoarthritis. And it's not very difficult to diagnose it. In osteoarthritis, the etiological factors, you will come to know whether the patient is obese, or whether there is overuse of joint, there is overexertion, the job of the patient has overexertion. And in rheumatoid arthritis, genetic factor is especially more prominent than osteoarthritis. So you have to take the family history, whether the mother was suffering from rheumatoid arthritis. And osteoarthritis is also genetically linked, but I have seen in many cases that in rheumatoid arthritis, the genetic factor is very prominent and very strong. And if a person is suffering from gout, you must come to know from the diagnosis only, because fingers are most affected, wrist and fingers, small joints. In gout, small joints are mainly affected. So this is the deformity seen in rheumatoid arthritis. When a patient consults us, we say the patient to do namaste. Yes, we say the patient to do namaste. Why we say the patient to do namaste? We want to see the deformity has reached at which stage. You can see here, the patient is doing namaste, and how the hand you can see. You can see a normal hand. How is the normal hand? It will be like this. In namaste position, it will look straight. Whereas you can see there is deformity in the rheumatoid arthritis. You can see here the Bottonier's deformity. You can see here the Z deformity. So from this only you can diagnose that the patient is suffering from rheumatoid arthritis. These are some more pics for y'all. See here. Yes. Here you can see clearly. You can see clearly the position of namaste, and you can see the deformities. The patient is unable to keep the fingers together. As we normally keep the fingers together, the patient is unable due to the stiffness. The fingers are stiff, and the joints are locked. The joints are locked due to the nodules formed, and you can see here the bulging. This is the special feature which is found in a rheumatoid arthritis hand. Such bulging is seen in there is swelling. You can see here. Yes, this is the edema. There is edema above the wrist. Edema above the wrist. This is a prominent feature seen. Then you can see this. You can see, just observe the fingers. You can see here that the patient is unable to keep them together. Normally, when we keep the hand like in such a position, the fingers are not so apart. But in rheumatoid arthritis, the deformity is such that the fingers cannot be joined together. They will be apart like this only. In this, you can see the deformities of the toes. All the toes are deformed, and there is edema on the ankle joint. The ankle gets locked in rheumatoid arthritis, and due to this, there is a tottering gait in patient. The patient is unable to walk normally. The patient is unable to walk properly, and as the disease advances, there will be such a severe deformity that the patient will be bedridden. In more advanced cases, the patient is unable to walk totally and patient is bedridden due to the locked joints. And one more thing is that in rheumatoid arthritis, the legs become curved. They will be curved from above, from the femur itself. They will be curved totally. So that will also, what you can say, change the gait of the patient. So these are the deformities in rheumatoid arthritis that we commonly see in day-to-day cases. So we have dealt with the allied part of rheumatoid arthritis, osteoarthritis. Now we have very good miraculous remedies which will help the patient to reduce the suffering and which will bring back the love of life of the patient which is lost due to the impending disease. So in this we have n number of medicines in homeopathy which are, what you can say, uh, wonderful remedies. We have very wonderful remedies. There are many remedies, n number of remedies like aconite nap. Then we have uh, arnica, we have pulsatilla, we have bryonia, we have calcaria carb. Calcaria carb is the most wonderful remedy which treats the patient very well. So we have causticum, we have colophyllum, then there is rustox, which is also a very good remedy. Thuja is a very good remedy. Medorinum is also a very good remedy. So uh, just one thing is important in diagnosing. The disease should be diagnosed properly and the similimum should be chosen according to the principles, according to the Hahnemannian principles of classical homeopathy. Then you can give perfect relief to the patient. If you will do any haphazard case taking and you will choose the similimum, that will not do. If you will choose a perfect similimum, then only you can give relief to the patient. So in homeopathy, we have very good remedies. Aconite nap. Aconite nap will the patient will be relieved by uh, hot application. And one more thing in homeopathy, I want to say that if you have proper deep study of repertory, then only you should go in for repertorization. Otherwise, if you will do any haphazard repertorization, that becomes a very difficult, means that is, it's very difficult to treat the patient as well as it's very difficult for the doctor to survive. So we have all these such remedies: ledampal, pulsatilla, calcaria phos. All these remedies will be very helpful for us in treating the arthritis. I want to jump to very nice remedy, a very wonderful remedy for arthritis, that is Calcaria Carbonica. This is a very wonderful remedy which will give relief to the patient. And the patient is also very wonderful. Calcaria Carb patient is also very wonderful patient. We'll see further. Yes, it is calcium carbonate. So it it can be used in many diseases, and we constitute the case with all these things, that is constitution and ailments, from then mental symptoms, then particulars, then modalities and relations. Yes, you can see the patient of Calcaria Carb, the lady, how you can see she's fair, fatty and flabby, easily tired on walking. There is much sweating and cold extremities. You know, the sweating of this Calcaria Carb is particular. The patient will sweat severely on the head, neck and back of neck and soles. This is the speciality of Calcaria Carb sweating. And the patient lady will be totally exhausted every time due to the sweating. Yeah. How's the baby? The baby is very chubby. The baby will be very cute, fair, fatty, flabby. Baby will have flushed red face, and the belly will be large like an inverted saucer. And the head of the baby is very soft because of the open fontanelles and sutures. And all the bones of the body are soft, and there are delayed milestones due to these this soft bones. How the milestones will be delayed? The baby will be late in walking, the baby will be late in talking, and the teeth eruptions will also be late. So how the Calcaria Carb baby walks? The Calcaria Carb baby will not crawl because the bones are very soft and weak. The baby will sit, and the baby will move in front. He can't crawl. Calcaria Carb baby can't crawl due to the soft bones. So all the milestones are delayed. Then sweat sweat is special. Sweat has a speciality in baby also, and all the glands are swollen. Now we can see how is the mentality of the Calcaria Carb. She's confused. You can see she's working and sweating. She's confused. Weakness. She's feeling weak. And one special thing is that when she works mentally, she feels more weak than physical work. So she is very tired after a mental work and sweats. And you can see she's very emotional. The Calcaria Carb lady is very emotional and always disturbed due to her emotions. And how are the emotions? The emotions are not true, they are false perceptions. All you can say delusions, all are delusions in Calcaria Carb. So she's always disturbed, and she's thinking and worrying, and she's always sad, in a vexed mood, vexation. She's always gloomy. Yes, this is a very nice point to be discussed. What she's telling, I'm right. I know I'm right. If you say anything, she will not listen to you. She will not listen to anybody. But she will say only one thing, that is, I am right. All should listen to me. She has what you can say prejudiced notions, prejudiced ideas already formed beforehand in the mind, and she will dwell on that prejudiced ideas, and she will say I am right always. So she forms the conclusion about things she wants. Are you understanding? Yes. What she will say, I told it's like this, so it should be like this. Such is the mentality of Calcaria Carb, and she is unable to accept any sort of argument. She will not accept any sort of argument to say her anything, but she will say, no, I am right. Now slowly, with all that mental symptoms, what happens? She becomes insane. She feels that she is going to become insane. She goes into insanity, imbecility, and in a general breakdown. And you know one thing, what is the special thing of Calcaria Carb? That she will just sit and she will feel that nobody likes me, nobody loves me, and she will dwell on that particular things again and again, and she will form this what you can say prejudiced notions in the mind, and she will dwell on all that things, and she will sit and loiter, she will sit ideally, and she will think over it again and again. This is the very, what you can say, sad feature about Calcaria Carb. And she always feels dejected, melancholic, restless. Anxiety is on the top. She's very anxious. Anxiety for everything and for anything. You can say like this, anxiety for everything and anything. She's so anxious that, what you can say, she's restless. Always her mind is working and working with anxiety. And she's also very peevish. She will have no consideration for others. She's very rude. She's very rude talker. Like other remedies, many other remedies are sweet talker, but Calcaria Carb is a rude talker. She will talk very rudely. She will never speak softly. So such is the Calcaria Carb lady. Now a very important point. She talks to herself. We feel like laughing listening to this symptom. Yes, she will sit and she will talk to herself, and she will say that someone was telling like this, other was telling like this, and she forms the notion that it is true. What she's thinking and what she's talking, everything is true, but it's all, what you can say, mangalan kahani. Okay, all imaginary. Everything is imaginary in Calcaria Carb's mind. Yes, she is very fearful. She has many fears. First of all, she has fear of darkness. She can't stay in a, what you can say, dark room. She will not go alone in a dark room. She will have fear of death. Then she will have fear of misfortune. She will have fear of impending disease also. She thinks that she has some big disease, a very serious disease, and she is going to die. Such is the fear of Calcaria Carb. And she has also fear of contagious and chronic diseases. So she has many fears. She is full of fears. The lady is greatly insomniac. She can't sleep. It's very difficult for her to sleep. She will lie down, and her mind will be working like a, what you can say, like a machine, and she'll think everything. She'll go into melancholy. She will be thinking the unprejudiced, all the notions which she has formed, and all that will keep her awake at night. She can't sleep, and due to this she will be having very horrible dreams. Then what we can say, one thing, that she says the patient will come and she will say, "Doctor, when I close my eyes, I see hideous faces. I see many faces as soon as I close my eyes." So you can point to one more remedy that I'll ask you in the later on. So what happens when she will try to sleep? She will see horrible dreams. She will see hideous faces, and due to this, she will be tired in the day. Due to this disturbed sleep, she'll be totally tired in the day and unable to perform the day-to-day work. Yes, this is one of the most important point which can point to the Calcaria Carb. What she's telling, I'm getting insane and people will observe it. Yes, she's she thinks that I'm getting insane, people will observe it, people will laugh at me, people will come to know that I'm getting insane. Such is the thought of the lady, and whoever whoever is laughing or whoever is smiling, she takes them negatively. Usually this happens. A Calcaria Carb lady, if she sees someone smiling amongst themselves or laughing, what she thinks that they are laughing at us, they are laughing at her, and they have seen her mental confusion. That's why they are laughing. This is a very, what you can say, this disgraceful symptom in Calcaria Carb. So we have, up till now, we have studied the lady of the Calcaria Carb. She was very much, what you can say, disturbed lady. Now the next wonderful remedy with which we are going to deal is Medorinum. Medorinum is a very useful remedy in case of joints. They will in We will be prescribing Medorinum when we will see deformities, mainly deformed joints. Means the patient will come when the patient will consult you late, when the patient has what can say, he has roamed all over, he has taken such n number of treatments, he has gone through all pathies, then someone has referred him to homeopathy. The patient comes and with deformities. At that time, Medorinum will work very miraculously in case of arthritis, when the joints will be deformed, the fingers will be deformed, and the main symptoms, you can say, there will be burning in the hands, there will be burning in the hands and fingers, and the constitution will be psychotic naturally. Medorinum constitution will be naturally psychotic. So Medorinum is a very important remedy. Some doctors refer it as Ramban medicine for arthritis, Medorinum. Okay. Yes, another efficacious remedy, rust toxicodendron. This is a very, very good remedy which every household should have, because nowadays in every household we find arthritis patients. So Rustox is a very wonderful remedy. You can say nowadays the season is rainy season. It is very useful in this season. When a patient will wet in rain, his arthritis pain will increase very severely. All the joints will get stiff. So when the causation is wetting in rain, you have to prescribe blindly Rustox. It will give you immediate results. And the main important symptom of Rustox is that it will have severe pain on first motion, and as the patient will start exercising means when he will be in continued motion, the pain will reduce. This is the main feature of Rustox. The patient will say, the patient comes to you with joint pains, and the patient says, doctor, I have stiffness, joint pains, swelling on the joints, and so and so. When you ask him that when your pain increases, so he will say, when I will get up from the seat. When I get up from the seat, I will feel severe pain. Means it's the pain on first motion that will point towards Rustox. And when your pain is relieved, the patient will say, when I walk a bit, my pain is relieved. I feel relaxed. Means amelioration from continued motion. So this is the efficacious remedy Rustox, which will work very good in arthritis. Next remedy is Colophyllum. Colophyllum, we will be prescribing Colophyllum especially when the small joints will be affected, especially of the uh, fingers of hands and toes. It's also a very good remedy, and causticum is also a very good remedy. Causticum will have a very typical, what you can say, aggravation and amelioration. The causticum patient will feel very better in rains. In rainy season, the patient will feel much better. Another out of the box remedy is Bryonia. Yes, Bryonia is a very good homeopathic remedy that has many therapeutic value. That has many that is related with many diseases, and it has a large therapeutic value. So Bryonia, we have seen that Rustox pain was increased due to first motion, but here in Bryonia, the patient will be suffering from pain by any type of motion. The patient will say, doctor, whenever I walk, my legs pain, my joints pain. So that will point towards Bryonia. Means his pain will increase with motion. The patient can't walk due to this severe pain, which increases with the motion. Then there will be typical thirst of Bryonia. There will be large quantity of their thirst for large quantity of water. The patient can drink 2 glasses together. So such is the bryonia remedy, which is also very good remedy for arthritis. Now we'll be jumping to Thuja, Thuja os. This is a very efficacious remedy in treating the joint diseases. It can also clear the fibrocytes which are developed in the joints. Thuja is a very good psychotic remedy that will clear the fibrocytes in the joint. So, whenever we see that a patient is psychotic, the patient is obese, the patient is what you can say, he will be flabby, the patient will have a large abdomen. So, Thuja will work very good in case of arthritis in such a constitution in obese patients. What happens when we are in a clinical practice? We get many cases of arthritis, and what is our duty? That we must give relief to the patient with a proper simillimum. So we are going to see a case today. This lady consulted me, Mrs. Nilima Shukla. She consulted me with the complaints of pain and stiffness. And this lady, she was having a very, what you can say, weepy mood. She was narrating the complaints and she was crying and crying while narrating the complaints. So she was having joint pains, then she was having pain in the shoulders, all joints. You can say pain in all joints, roughly. Then the pain was aggravated by cold weather and washing, especially washing. After bathing, after bathing, the pain used to increase a lot. She used to get, what you can say, she used to become insane. She used to become insane after bathing. And one more thing I want to say, that mentality of this lady was exactly pointing towards the most wonderful remedy which we have discussed before, with all the nice animation pics we have discussed. So it was a very interesting case, and I liked this interesting case while dealing it with, and I was very happy when I was able to give her the results. So she consulted me with all these complaints. Aggravation was cold weather, change of weather, washing, and exertion, especially. Amelioration was dry weather and heat. And she was suffering since last 2 years. And constitution of the lady was typical like the wonderful remedy. It was fair, fatty, flabby, and she was having blushed cheeks. Her face was blushed. Then uh, appetite was diminished, thirst was normal, sleep was unrefreshing. See, we have discussed before. I we have discussed before also, and I'll discuss after also the wonderful remedy. So her sleep was very unrefreshing. She was telling that I feel like sleeping, but I can't sleep. I have horrible dreams. Then I have many fears. She told I have all the fears. Then dreams, yes, she was having fearful dreams of ghosts. She was seeing all the ghosts in the dreams. Then sexual relations were decreased. Natural eliminations, she was severely constipated, and she was feeling well while constipated. She was not feeling uneasy while constipated. There was no acidity, there was no hyperacidity, there was no, what you can say, there was no discomfort in the abdomen. She was feeling well while constipated. Then after that, what you can say, urine frequency was there. And one more thing I want to discuss, that uh, the lady was very rude while giving the case. She was talking very rudely, very roughly. Yes, she was of age 55 years, so she was menopausal 5 years back. Then she was having two issues. She was very chilly. She wanted more clothing. Not only sweater was not sufficient. She wanted 2 or 3 clothings during winter. She was such chilly patient. Then about the life space. Yes, while discussing the life space, one thing I observed that when she was discussing the life space, she was weeping. She was weeping in the whole case. So, her life space, childhood was happy, and there were some hindrances in adulthood. After marriage, she suffered a lot at the hands of in laws, and due to this, she was very much depressed. Then, especially what she says, ki, I feel like I'm going to become mad. One day I will become mad, she was telling. Fear of insanity. She was having fear of insanity. Then she was melancholic. She was always brooding on particular subjects. He told like this, she told like this, why he told like this, why she told like this. Continuously, her mind was brooding. And due to this, she was always in a sad mood. Vexate. She was always vexed. Then she was having fear of darkness, fear of ghosts, fear of impending diseases, and her personal life was disturbed due to the impending diseases was her conclusion. This was her conclusion that her personal life was disturbed due to the impending diseases. She was feeling that she was having many diseases. All these was what? It was not true. All were delusions. She has formed all the notions. Then about the past history, she suffered from jaundice 2 years back. Then when family history was asked, rheumatoid arthritis in mother was found and heart disease in father was found. On physical examination, she was very pale. Pallor was seen. Then edema of knee joints, ankle joints, and fingers were present. Systemic examination, slight deformities of the joints with disturbed gait. Yes, this was the particular thing. She was limping while walking. The gait was too much disturbed. So on when I asked about the gait, she told that she she feels stiffness. Always she feels stiffness. That's why she's limping. So on investigations, the rheumatoid factor was found positive. It was 30 international unit per ml. HB was reduced. She was anemic. ESR was raised, and in radiological examinations, slighter deformities of the joints were seen. Then the disease diagnosed was rheumatoid arthritis. Remedy given was after considering all the symptoms, remedy given was Calcaria Carb 1M because complete constitution was of Calcaria Carb. So Calcaria Carb 1M was given on the follow-up day for 7 days, BD for 7 days. Then she, what you can say, she told that I have slight relief of pain and stiffness. She told slight, but she's feeling better. This was her sentence. I have slight relief. But I am feeling very well. I'm feeling much better than before. What is this? Much better than before. This means that homeopathic remedy has acted. It was chosen correctly. You know what happens when we give a homeopathic remedy? It acts on the dynamic plane, and first symptom the patient will say that I am feeling better than before. This is the return of the lost love of life which the patient has suffered due to the impending disease, right? This we are taught in our homeopathic subjects, that homeopathic remedies returns the love of life which the patient has lost. So the patient will come and tell you, I am feeling better. The pain was slightly reduced. The pain was not reduced much, but she was feeling better. This is the action of the homeopathic remedy. Then next, she was given again in the next follow-up. She was given Calcaria Carb for 7 days, and she was feeling much relieved. Means the pains were relieved much than before previous follow-up. and she was feeling much more better. Much more better means what? She was feeling as if her disease has gone, and her mental symptoms were reduced, and she was not at all weeping now. She was smiling. She was smiling on follow up. In the first follow up, she was weeping. So the continued follow up is continued, and the lady is very happy with my treatment. Now we will discuss one more speciality of the Calcaria carb, one more special features of Calcaria carb in this thing. So the wonder remedy which was prescribed was Calcaria carb, and it is a very good remedy which will have all these general features. That will be anemia, the patient will be very chilly, the patient will be perspiring all the time, profuse perspiration with sour odor. The patient will perspire and become weak due to perspiration. And there is weakness, both mental and physical, both weakness will be seen, and the patient is totally tired. Now you can see here again a plump lady, fair, fatty, flabby with flushed face, and the patient is anemic. You can see the paleness of the lips, fingers, and ears, and the patient is weak, tired, and the heart is also weak. The patient also has difficulty in breathing. Yes, this is also a feature of Calcaria carb. When she will climb the stairs, she will be dyspneic. The patient will suffer from severe dyspnea. Yes, now you can see this lady, beautiful lady, Calcaria carb lady. She's very, very sensitive to cold. She will be, what you can say, always she will try to cover herself in cold weather. She will be suffering from cold, damp weather, then cold air, then change of weather. Yes, this is a very particular thing which will be found in Calcaria carb. All the pains of arthritis will increase in change of weather. When the weather will change from one weather to another, the patient will become restless. Back, 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 back. क्या हो गया? और back. Yes. And one special feature is the body is cold to touch. Always the patient is very cold on touch, and she wants plenty of warm clothing. Yes, she wants plenty of warm clothing. You can see she's covered. So, how the lower limb will be affected, you can see. There will be swelling, stiffness, and aggravation bending. There will be aggravation bending and also aggravation by motion, and also by first motion like Rustox. General modalities will be aggravation from cold, then there will be exposure to cold, change of weather to cold, and change of weather in damp weather. Also aggravation from exertion. Yes, lifting, walking, and going upstairs will increase the arthritic pain. So this was about the arthritis of Calcaria carb. How is the arthritis of Calcaria carb? We have seen that Calcaria carb is a wonderful remedy in arthritis. So accordingly, we have discussed it when it was prescribed. We have discussed all the We have seen how the lady is, and how she suffers, and what are the aggravation, what are the amelioration, and what are the effects of change of weather, of aggravation, amelioration on the patient. And one more thing I want to say, that when a patient comes to us, we must observe the gait of the patient. First and foremost, we must observe the gait of the patient. Is the patient walking normally, or patient is having any deformed gait, or is the gait changed? From the point the patient, from the time the patient enters your clinic, from that time you should observe the patient minutely, and you should gather all the things, abnormal things, what you are uh, observing in the patient, and you will, in case checking, you should include that abnormal things. From that you will come to a conclusion. You will come to a conclusion that which remedy should be given, because when a homeopath becomes, you can say, senior, they will, when they become senior, they will have a habit of doing all this. Juniors will find it a bit difficult, but senior homeopaths, they can observe, they can observe the patient, and they can cite the remedy. Such is the, what you can say, the study of the practice. So we have discussed various remedies for arthritis, and we have discussed how the different aspects of Calcaria Carb, how she is, and when Calcaria Carb should be prescribed. And I want to give an advice to the students, that when a patient of arthritis comes, what first and foremost, the thing you have to do is proper case taking. Then after proper case taking, you should separate the mental symptoms, physical generals properly, and then you should conclude the medicine. And while prescribing the medicine, you must think about the proper potency and about the frequency of the doses. This also is very important in homeopathy. Frequency of doses. You should not give any haphazard doses. You should not repeat it. Some persons I have seen, they will repeat the remedy for months and years together. But that should not be the case. Whenever the remedy starts acting, we should reduce the weight in dose, and we should wait and watch. And this should not be that it is that homeopath is given such, so I should also give like this. You should not conclude like this. You should have your own notions. You should have your own ideas about the potency selection. So we have very good remedies for arthritis in homeopathy, a very good treatment for arthritis, and you should apply it with your proper knowledge. So I give a big thank you to all for observing and what you can say, sharing my knowledge with you with such a great patience. And I once again thank the team, PGen Publishers, Manish sir, and I thank Hussein sir for motivating me for to conduct this webinar. So a great thank you to all. They will.
Thank you so much, ma'am. Thank you for your for a great session and giving a valuable information. I would like to invite Dr. Akhilesh sir
Yes, sir.
for the. Now we'll have a question answer session at the end. So I request Akhilesh sir to continue the session.
Okay,
So
ma'am.
what is the option for my presentation? There is no option for presentation. Slide. Okay, okay, okay. Okay. Can I start now? Okay. Good evening, good afternoon, good morning, everybody. as different part of the countries and other countries also doing this program, this important program, important session. I extend my heartfelt thanks to B Joint publishers. Special mention to Dr. Monish Join and the anchor coordinator of this particular occasion, Dr. Jessica Arora and her team. And I congratulate Dr. Zehra Haq to present her presentation today. My topic is iatrogenic disease and scope of homeopathy. It's a very relevant topic, I think, today in this present era of medicine, when entire universe is suffering from a COVID-19, whether it is a human-made, whether it is a natural, I do not know. We do not know, but there are a lot of questions whether it is Frankenstein or not. I will also give some light on that aspect also, because what is the scope to treat the iatrogenic diseases in scope of homeopathy. My viewers, my students, my teachers and practitioners, those who are attending this occasion, I would like to dedicate this oration to Professor Ananda Mohan Chakraborty, recently deceased on 10th July at Chicago. Was very close to us because few years back he came to my college and attended a All Bengal postgraduate seminar, who invented a bacteria, genetically engineering bacteria, Pseudomonas putidi. It is popularly known as oil-eating bacteria. I dedicate this session, particularly this oration, to this great personality of India. He was Padmashi. He also invented another T89 amino acid for preventing the growth of the cancer cells, but it is awaiting because still now, before his death, till now, he did not receive any patent from the USA. He was recommended for Nobel Prize, but we know that the politics and crux of the Nobel Prize winning, I do not like to discuss here. I dedicate this program, this oration, to this great personality. He came few years back. I am receiving with this person in all Bengal PG seminars. My viewers, my topic is iatrogenic disease and the scope of homeopathic treatment. The today's slogan: the man dies of owing to the drugs, not due to disease. Yes, that is the problem to us. When the World Health Organizations declared and denounced in some aspect to prescribe indiscriminate prescription of the antibiotics, and naturally every time since master's time and even today we are getting, or rather the popularity of the alternative system increasing day by day. Homeopathy is not exempted from master's time and even today. All the medicines are having the bad effects. All the medicines having side effects, and these are numbing and producing different devastating weakness of the human economy. Even the virus, even the bacteria, even so many natural diseases, though natural, might be due to the bad effects of different types of DPT owing to the suppression. A quote from the Oliver Wendell, that if all the drugs in the world could be damned into sea, it would be better for mankind and worse for the fishes. What he says? So please think about the matter. Every webinar, every seminar have a two aspect. One is the academic aspect. Obviously, my students will enrich from my seminar. Of the social aspect and national importance, what common man will learn from my lecture and your lecture and our lecture. That is the point of discussion. So, if your drugs being thrown to the seas, what happened? It will be better for mankind, and the fishes will die. Indiscriminate use of the caused an increasing number of the antibiotics prescription written for the common cold, flu and similar viral diseases, and undiagnosed fever are unnecessary. in a PO, indiscriminately uses antibiotics, and owing to that the patient never cured, and ultimately shelters the homeopathy, take the shelters of the homeopathy or any other alternative symptoms. Obviously, I will try to establish the homeopathy is the peace seller. Peace seller means there is no alternative. It is a English phrase, or no alternative is the best way to treatment of these iatrogenic diseases produced by indiscriminate use of the non-homeopathic drugs. I say non-homeopathic drugs, not only the modern medicine, other medicine too. If you open your newspaper daily after waking from the bed, donate kidney, donate kidney, donate kidney. Please give the kidney. Why? Even 30 years back, even 20 years back, when I was a student of A.H.M.C, never saw this type of advertisement in newspaper, second page of the newspaper. Give kidney, keep. Who is responsible for that? And what are the causes by which our organs are being damaged? Obviously, a great role of these disasters contributed by allopathic and different non-homeopathic drugs. Question of contemplation today, my friends, my students, my viewers, that we should think what is the running today, even in COVID, what we are doing, and what is the scope of homeopathy, and what the other pathies are doing. And due to the contributions and due to the bad effects as produced by the so indiscriminate use of the antibiotics and others drugs, and we are facing a lot of troubles in an economy, the total immunity systems being damaged. Obviously, there are other greater roles in addition to that. What Aridajan says, and Aridajan submission I should quote over here, because in the introduction chapter, because there is the introduction is given by the translator. Aridajan is the translator for 5th edition. Because when I was a student in syllabus, even few years back, the only 5th edition was included, and thereafter the both edition is included. Now the only 6th edition, but the 6th edition is nothing new. There is some adding over there. I am not presumed to criticize the views or statement of the author. Author means Master Henneman, because he translated these views. His denunciation of the practice of the old school, so quite deserved when he wrote, are not inapplicable to the present condition. Hari does not find in the 3rd paragraph of the introduction written by the translators that deserved when he wrote are not inapplicable to the present condition of the allopathic medicine. It is beyond all question that it was mainly owing to the treatment and practice of Henneman and his disciples that the disastrous methods involved centuries previous to scientific character or success then, and those they have succeeded. Were Henneman alive? Now we can easily imagine how he would have inveighed against the school medicine of the present day, the markularization against which Henneman waged successful war, because there are some sorts of changes even after the publication of the organon medicine. The changes, the two eras were divided before the introductions of the penicillin, after the publications of the organon, because they changes themselves, they modified. They did not use in a certain period of time. They did use the mercury, prussic acid, butyric mode of treatment. Ultimately, they changes. So what you was done in introduction chapter, that was very much pertinent at that material point of time. But even today, now the introductions of the penicillin and others, they are telling no, we are not old school, we are not modern medicine. So let us discuss what we are feeling today and is there any real change between the Henneman what he observed in organon medicines? But though that Mr. Dajon has says, obviously there are some change. Let us discuss. What is iatrogenic disease? Iatrogenic disease, that means any untoward activities or consequences derived the preventive, diagnostic and therapeutic regimen or procedure that causes impatient handicap and disability, death resulting from physicians professional activity or from the professional activity of the other health professional. So this includes even it is the consequence, the bad effects of the preventive medicine. It is the consequence of the bad effects of therapeutic regimen and procedure and impatient and handicapped disability produced by some that physician's professional activity and the misconduct done by the physicians, also others person including the professions. So this is the time of heterogeneous. There might be two types. It is a medicinals or drugs produced by drugs, and by non-medicinals by surgery and by the professional error. The heterogeneous state can be produced. Therapeutic medicine and preventive medicine. Again, the medicinal drugs can be divided into two. The therapeutic medicine and preventive medicine. The therapeutic medicine again divided by two. The repressive drugs are one drug drugs. Repressive drug, it is very nicely, this particular term is repression is used by Hahnemann in the chronic diseases. And the homeopathic medicine, even it can produce the heterogeneous diseases. The homeopathic medicines, the rational potentized medicine, yes, the rational potentized medicine can able to produce the heterogeneous medicine if it is not rationally used. So-called homeopathic medicines, if it is not rationally used, so that it is a question of discussions. By the pseudo-homeopath, they can produce a pseudo-homeopath. That better term is the Mongoloisms. One time they use and one time they uses. Sometimes they uses the homeopathy in the allopathic way, or sometimes they uses the homeopathy in homeopathic way by using the mother tincture, pseudo-homeopaths. So these are the conditions by which a heterogeneous disease can be stopped by the therapeutic measures of the repressive drugs and wonder drugs, and also by the homeopathic drugs. And the medicinal disease, heterogeneous disease can be produced by preventive medicine, by the immunization, bad effects of immunization, bad effects that they do not consider the bad effects, but lesser amount they consider. But we know the bad effects of immunization, vaccinosis. Hahnemann himself considered, thereafter so many stalwarts considered the vaccinosis. So disease also can be, this can also be included in the heterogeneous diseases. Non-medicinals, the surgical procedure, sometimes they produce an heterogenic state by the way of false surgery. False surgery, you know the difference between the true surgery and false surgery. Why the surgery is noted, sometimes there is no indication of surgery, and only homeopathy medicine can quite impossible to cure the situations. But in spite of that, use that particular removal of the particular organ and ultimately causes the damage of the organ and the function of the organ guns. Like commonly we observe in case of our practice, the tonsillitis, ultimately they get it cut it out and the surgery, but the tonsillitis we have lot of scopes. There are professional errors in the prescription writing. Prescription writing is not eligible in proper way. Sometimes the compounder become confused. They give other medicines. So therefore, when they give the other medicines in not the indicated medicine, even in homeopathy, even in allopathy, with the professional errors. Professional errors, immunization. Sometimes you observe in my practice, in my daily in the health centers, or when I did my work, by the cold chain system was damaged. Owing to that, the vaccines was damaged, but it was distributed and immunized to the common people, and owing to that, so many people died. So that consequences we observe in so many paper and newspapers. So we should think of this heterogenic disease. Now, the term heterogenic disease, the term of Hahnemann as artificial chronic disease are synonymous. Oh yes, whether you will agree or not, but I do agree. This is yes, it is nothing but synonymous. Artificial chronic disease, as termed by homeopathy, in orthogonal medicine, in iron chronic disease, this is nothing but the heterogenic disease. Heterogenic disease. Now, all therapeutics produces heterogenic disease. If I say the question, you will reply, yes, sir, I do agree with it, because allopathy and AYUSH system, all system produces heterogeneous disease with the bad effects of so many diseases, but they do not follow the rules. And allopathy, it is proved. Now termed as modern medicine is proved. The AYUSH system, A for Ayurveda, yoga I do not know, because yoga, whether it is the system of medicine or therapy, I do not know. But yoga is added with the naturopathy, because the naturopathy, they apply something, they administer something, and so when they prescribe on that point of view for application in human organisms, and sometimes they suppress the disease. So, but the yoga, when it is added to the naturopathy causes, and Unani and S means Siddha, and also Siddha follows sometimes of principles by applying some medicines, and H for homeopathy. So homeopathy also having some produces. The iatrogenic disease, as you know, while Master Haniman create aphorism number 4, what is artificial chronic disease, and aphorism number 75, most deplorable and most incurable chronic disease in this human heart. But and when and how this disease are to be treated, this is discussed in the aphorism number 7. My students, my viewers, and please go through these books and please try to understand this one, and how artificial chronic disease is removed by repressive drugs, how artificial diseases are formed by repressive drugs. These repressive drugs are common, as you know, and the calomels, marker at that point of time during Hahnemannian time, but the repressive drugs are not being changed into wonder drug. But the new repressive drugs are not available today because they have changed there after the introduction of the penicillin, after the introductions of the steroid group of drugs. So these repressive drugs you do not see it in allopathic practice. Calomel, quinine, foxglove, prussic sulfur and sulfuric acid, and venesection and leeches. Though venesection, though cupping, the immunotherapy also follows this. And issues set on do not know, but cupping and venesection, at least the cupping they uses, the cupping, the Hahnemann would condemn it, even medicine they are applying to it. So let us through. I have told you earlier, so the consequence of the immunizations, that condition may produce the iatrogenic disease. That condition. So what is the role of the homeopathy in case of the immunizations, bad effects of the immunizations? And the immunization, both antenatal and postnatal, what are the materials are given in the form of vaccine, in the form of immunizing materials, they produce some sorts of disease condition. But it differs man to man, but later discuss. So what are the common adverse conditions which see in my practice, that the oral vaccines or polio vaccine, measles, these are the common iatrogenic effect we see in our practice, that diarrhea, very rarely vaccine associated with the paralytic. Even after giving the paralysis develops, and IBP, local arrhythmia, and in duration you observe measles, observe anticipated reaction, mild fever, coryza, toxic shock syndrome, and exaggeration of TB even, and encephalitis we have observed in practice. In first part of life, when I did not enter in the college services, I was posted to Public Service Commission in the rural area of the Bengal as a homeopathic medical officer, as the first batch of BHMS and the first batch of the medical officer through the Public Service Commission in West Bengal, and I practiced. I posted in the rural health center. I had the opportunity to see the bad effects of the vaccinations in rural areas and tackled so many cases by homeopathic medicines. Our experiences such things. MMR also. At that time, MMR was not so much popular, but that these vaccines are very much popular. Now, the mumps vaccine also produces adverse reactions, fevers, encephalitis, and parotidial inflammations, hemangic urea syndrome, and meningitis in autism they can produce, and BCG vaccine, and prolonged severe ulceration they produces. Vaccinations. In all patients, no, differs from the constitution to constitution. Rubella also, we observe some side effects. Hepatitis vaccines, local reaction is a common reaction. It is so much not painful, but the other reactions are very much painful, and we have to tackle these consequences with our medicines. Or our hepatitis B too produces some sorts of trouble side effects and produces some iatrogenic diseases. So if vaccine itself, the vaccinosis, the condition is nothing but the iatrogenic condition, as it is produced by the vaccines. And typhoid vaccine, it has also so many nausea, fever, chronic disease, and relapse of the chronic disease like rheumatoid arthritis, relapse of the chronic disease and rheumatoid arthritis, tetanus toxic, and it is repeated if it is, and it also if it is repeated, then it produces varicella vaccine. It has also some sorts of and systematic reaction it produces. Fever, it is a common phenomena. Sometimes vesicular eruptions are produced. Rabies vaccine have some is now used very frequently after the bite of the dog, and etc. also produces some sorts of actions. When it enters anything, antigen enter the antigen antibody, and antibody may produce some sorts of reactions ultimately with our the myogenic constitutions, because it may rise up by producing some such conditions as just I have stated here. Now, homeopathic viewpoint, what are the hazards of the vaccination? Whether animals supported vaccination or not? So let us see that yes, in aphorism 46, 4th, 5th, and 6th edition, if you go, that he supported the generous vaccinations. That after the inoculations of the generous universal situations of the generous vaccination, the present generation do not know the smallpox, that when dragging around on at one city to other city, the entire 2/3 of the child died of that. And the aphorism 56 also, he's also supported general vaccinations, but he did not support the bad effects, because in the same 46 aphorisms there are 11 examples, and out of 11 examples, in one example he saw that the cowpox vaccine that cures the permanently smallpox, but the accessory medicines, it produces a permanent impression, a peculiar long-standing cutaneous eruptions. So this is the cutaneous eruption due to the bad effects of the vaccination. In chronic disease, he also mentioned this one. He mentioned in chronic disease that in similar manner, the peculiar nature, volume 1, page 33, the bad effects of vaccinations. So please go through this one. I do not like to quote it or read it, because in the presentation, that is not the question of reading out. Just in your memory, I am telling you, please read it with consult your for purposes. Next, this is the what Bonington. Even Bonington too, he felt it, because the Bradford, when Bonington, he made a consultation of the meeting with him, and he mentioned that one questions, the concerning of the curative of the Thuja, and about that, the Bradford says the Bonington brought up a vaccination meeting in considers, and he also told that he was worried about that situations, bad effects of the vaccination. That vaccinations is nothing at bad effects is producible iatrogenic disease. The Barnett, we know very popular about that. The vaccinosis and its cure by Thuja with remarks and Barnett's, because he was, you can say, is a pioneer to evaluate the vaccinosis, and he has contributed a lot of literature in this respect. We should know this one, and therefore the Bonington is some sorts of repertory. We would like to repertory work, we go through some repertory work, and we'll get that some Bonington chapter. If you go, you'll find the sensation chapter, the vaccination after Epis Thuja, and stool aggravation after vaccination Epis and Thuja, sensation and complaints in general after prophylactic Thuja and sulfur, aggravation and emulation in general chapter. If you go and rubrics with their vaccination, there are Calimure and Melandrinum rustux. So our stalwarts, our literature shows that the vaccination can be considered as the iatrogenic disease state as produced by them, and it has some way to cure their effect by the way of homeopathy. The Bonington's repertory, if you consult it, even in the Keynes repertory, you will get it. Keynes repertory, you will find the chapter, generalities chapter, and the rubrics is the vaccination after generalities chapter, rectum. You will the convulsion, that is the convulsion vaccination after, you get the silicea, eye symptom after vaccination, Thuja, cough symptom after vaccination, Thuja, extremities, and the demarcation upper part, lower part after Felon after vaccination, Thuja is the medicines. So repertory work will get that the vaccination effect, bad effects of the vaccination, how that can be removed, and on that basis we can apply the medicine, that effect can be removed. Now, the repertory of the different mathematical and repertory of the different media just I told, and even in the extremities chapter, general paralysis of the lower limbs, vaccination by Thuja, another thing. So some therapeutics, if you go through the therapeutics, you will get that there are a lot of medicines. We have antimtar, meserium, Thuja. These are the very good medicines. You please consult this book on Allen Herring, and you'll get, and the each like eruptions and Thuja accidentalis. That is very popular one. Just I have gone through the repertory chapter, what we see, and that has been just incorporated also in this respect. Now this one, another, the silicea also bad effects of vaccine, Crotellus horritus, and please read the Barnett's vaccines in its cure of Thuja. It is, my students, A good doctor is a good doctor when he refer the case in a particular time, in a particular point of time, that patients can be left. What is curable, what is incurable. So in a similar point of time analogy, that I am a teacher, because I am a teacher, still I am a student, I would like to refer you, please consult this book wherein he has written a good deed done by our stalwarts in the context of vaccination, in the context of prevention of the bad effects of the vaccinations. Repertory just have seen, and even in the therapeutics, different medicine just have quoted. There are a lot of medicines. Next, the side effects of some wonder drugs. Now the repressive drugs have been changed in the wonder drugs. Wonder drugs are known as the miracle drugs, marvelous drugs. It is a term used by the modern medicine, term used in the parlance of the medical parlance. The old system of medicine, it is ignored some sorts of what is written in Materia Medica, what it is in Organon. If you open the dictionary, you will not find it, because there are sorts of changes. It is only available in the homeopathic parlance. It has been changed. It has been changed. So in the context of the modern science, we have to look the homeopathy, because the Darwin says, in the earlier part I have told you, it is our responsibility how we'll deal the homeopathy in the present science. Today the repressive drugs are so much not used in the way of prussic acid, in the way of foxglove, in the ways of clusters of other thing, or clusters, or by cetones, not in the way of bruceitic mode of treatment. But today the change has occurred. Now the repression has been changed by the wonder drugs. Wonder drugs is a popular term in the medical terms after introductions of the penicillin, after the introduction in 1942. Though it was discovered in the just 100 years back, not 100, just 19 or like that. That wonder drugs are there. These are known as the miracle drugs. Produces few but dangerous side effects. And it is our discussions in last part, just what I have told you, that we have to point out what are the wonder drugs today. That prussic acid, the repressive drugs have been replaced. If the Hahnemann alive today, he could change these versions in today. So it is our duty to change. If we interpret the vital force in the way of dynamic influence, the dynamic concept, it will be very, very ridiculous to the students who are coming into the students after passing the physics and chemistry. When the dynamics is introduced, when the others advance of the science, nanotechnology, it is our duty to interpret in the form of nanotechnology. And the Hahnemann was so much correct, because the science was not so much developed in that point of time, because Hahnemann was correct at that material contact. So in these ways, we have to study and we have to read Organon, and we have to read the literature of the old homeopathy, and that should be until. So the wonder drug are aspirin, steroids, penicillin, painkillers, tranquilizer, insulin, not prussic acid, not mercurial preparation, not bruceitic mode of treatment, no cetones, no triphenyl is available. But forget it. Now the wonder drugs are today. And what are the bad effects? I've just shown you earlier through the slides. The bad effects, how to remove, get rid of from the bad effects. Are the repressive drugs are Hahnemann era used by the present days allopathy? Yes or no? If you ask the questions to me, I will say yes. But in true sense, it is no, because it has been changed in the wonder drugs. The repressive has been changed. If you open the repressive drug, it is not my term. Repressive drug is by the Hahnemann in the chronic disease, by the repression. Only I saw the Vitolkast literature, he was the particular terms, repression. Whatever generations you may belong, but you might have to forget that generations. This young generation, now the students of the young generation coming to us, we have to interpret in this way in the modern technology. I will let the condition, dynamic influence, or dynamic whatever may need. Miasm, it is still relevant. We have to interpret it. Organ needs interpretations. Now some drugs, some wonder drugs, the hormonal contraceptives. Continually our ladies are taking, women community are taking, and owing to that they're suffering from high blood pressure, high weight gain, and there's a sore throat, irregular headache, and commonly they meet with us. Doctor, I'm taking the hormonal contraceptives because I do not go through the intrauterine devices, because I do not do permanent ligation. But what to do? Please get rid of, please give some remedy, and they consult with us. And that situations. Intrauterine device, It also produces different types of antibiotics in the disasters, digestive problems, and that's vomiting, nausea, drug interaction, fungal function, difficult, the damage of the intestinal flora, and anaphylaxis is a common reaction. As we have so many, it is not common, non-common, and we saw and we observe the kidney failure and also hampers the immunity system and general weakness of the patients in case of the antibiotics. So therefore, the World Health Organization's steroids, another wonder drug we have included. Steroids, at any one in time, the steroids are not used. The steroids, the bad effects of steroids, anabolic hormone. The anabolic hormone or athletes are commonly used. Anabolic hormone, and the indiscriminate use of the athletes are using that anabolic hormone. It produces some bad effects. Temporarily, it gets vigor and energy and plays good and win a prize and trophy. But what he did in his life, ultimately life trivial. We saw so many people, even I do not name the person, a good, very good person in the world, and personality who died, who used to ultimately forensic investigation proved that he used to anabolic hormone. He died. He was one of the billionaire and trillionaire of the world. He died in a very, very early age, as you know. That you don't disclose the name. Very popular man, and the oral steroid and the blood vision and the glaucoma, easy bruising difficulty, growth of the body here. Anabolic steroid causes permanent health problems, kidney disorders, kidney problems, and changes of the blood cholesterol. Students, those who are reading the organon medicines, you please forget, but you try to interpret in the modern science, in the modern present, because the what organon tell that is not available out. We have to find out the advantage, adverse action, and we have to treat it. Do a steroid shortens the sentence of the life of the obvious. Yes, life of the yes, I can say span of the and produces painkillers, indiscriminate use of the painkillers by the non-homeopathic users. Why I say non-homeopathic users, even in modern medicine, they commonly used as combiflame and so many combinations. But even in so many other pathies, they are giving some advertisement. You will big advertisement in the newspaper, sir. Joint pain ke liye, arthritis ke liye. Don't go to the Zehra madam. You please come to me, and there you will get some plaster and others. And koi jarurat nahi hai. ऐसे कुछ advertisement आता है. You please think of that. These are nothing but the wonder drug. The repression are damaging the total economy. And so the painkillers, whether in the forms of the modern medicine, whether in the forms of the other pathies, but ultimately Zehra ma'am will cure that arthritis patients and relieve that persons. Aspirin is commonly, even the pawn shop. If you go to the grocery shop of the village area, they supply aspirin group of medicine. No require a prescription. Indiscriminate aspiration. So mere say headache ho raha hai, please give aspirin. And commonly uses the aspirin. And owing to that, common indiscriminate use of this in large doses and different types of problems, even gastrointestinal problems, gastritis, and drowsiness, headache, cramping, and antacids, another wonder drugs, that repressive drugs transformed into wonder drugs, that continuous effect of antacid. So antacid commonly just jaise murmura kha raha hai, chewing like murmura, just chewing like murmura, aise the parts rice, they're chewing that, and antacids commonly, and that bad effects of the antacids, I know the diarrhea, changes in the metabolism, and magnesium imbalance, and that magnesium imbalance causes kidney features, kidney troubles, and even indiscriminate with the magnesium ultimately cripple the body. And other that the sleeping pills is the common. Today you are taking one pill, the next day due to secondary counterction you have to take the another pills, continually increasing. That sleeping pills also another dangerous things, as we saw. And because of the stress and strains of this modern economy and modernization, the civilizations, human economy are suffering from the sleep losses. It's not due to disease, it's not due to any physical condition. but the mental stress and strain, and going to sleeping pills, and the bad effect of the sleeping pills is dizziness, slight headache, and gastrointestinal trouble, prolonged drowsiness, and severe allergic reaction we are finding this type of patient. And steroid creams are commonly, they do not is using the sulfur cream or sulfur ointment and prussic acid time. The continual effect of the steroids, what we see, that the bruising, discoloration, the permanent stretch of the muscles and the hair growth are coming to the patients, and the common people are suffering from this one. Adverse effect of the medical procedure treatment of the iatrogenic. For examples, I can say aside the radiation therapy. Yes, it has. Chemotherapy, it has, because after the chemotherapy, the cancer cells may die, but ultimately what happened, they hair loss, hemolytic anemia, diabetes insipidus, vomiting, nausea, brain damage, and lymphedema, infertility continuous. So these are can be considered the iatrogenic disease. How to get rid of? What Hahnemann said, what our literature says, that had to be find out. So my subject was iatrogenic disease, that to be pointed out in the modern eras, not in the context of organon medicine, but the organon medicine was correct, too much correct at that point of time. Now that repressive drug had been transformed into wonder drug, that wonder drug to producing iatrogenic diseases, that I have pointed out some activities. But how to get rid of? I have shown you the problems. What is the solution? So let us see the solutions, please. My homeopathic approach to tackle of the patient may come to you. Patient may come to you directly. Patient may come to you indirectly. Patient, those who are coming to you directly without consulting in a physician, without consult, very good. You will get the clear picture of the miasm. But the patient, if it is coming, if you are getting the medical history, past history, you have taken any medicine earlier? No, I have not taken any medicine since my birth. I am taking only natural medicines, or depending on my diet and such. Very good, you will clear the clear picture of the miasm. But what happened? Most of the patient will come two ways, either by from the allopathy using the wonder drugs, or by homeopathy. Yes, I say homeopathy, but those homeopaths are using homeopathy indiscriminately by the operational approach, even by potentized medicine, not follow the proper potency, not following the proper repetition, not following the proper dose. They are giving the potentized medicine, repeating the dose, not necessarily repeating the dose, provision they have oversensitive of the patient, as because Ken says in oversensitive patient in that you should know that particular lecture in 16, you will say that even the drug myosin can be produced by the homeopathic medicine or allopathic medicine. The drug barrier means just imitating some acute miasm and imitating some acute miasm or imitating some chronic miasm. Understands? So Hahnemann can't also consider these ones. So patient may come directly. If they come directly, okay, you can take it. But my question is, patients are coming indirectly. So therefore, first we have to take the wonder drugs. Prolonged use of the wonder drugs. What are the bad effects of the prolonged use of the wonder drugs? Will cause the manifestations of latent miasm and transform into secondary miasm. Mostly secondary miasm, because this is the multi-miasm effect are seen in these generations. The miasmatic transgressions, miasm transmutations, generation to generation. What nicely Hahnemann has described in the chronic disease, and thereafter the Allen has developed it. Hahnemann has clearly said, the only due to there is a debilitating patients and the unfavorable conditions, but especially due to use of the prolonged use of repressive drugs. Now the wonder drugs are causing the explosions of the sora and turns into secondary manifestations. So transformation of a state as a produced by artificial chronic disease, that is the iatrogenic disease, and the natural is a state iatrogenic as produced by both. So therefore we are not getting the clear picture of the disease. How to obtain the true picture of the chronic disease? Hahnemann stated very nicely in the organon medicine. You please read organon line by line, to the line. Hahnemann has given lot of scope to how to treat the patient in such condition, how to treat the patient if your medicine knowledge of medicine is very poor. 160, 163, 164, 167. And similarly, how to obtain if you go to the drug case taking chapter. This is in case taking chapter. Yes, nicely said. In chronic disease, the original disease picture is to obtain by referring the original symptom appearing before taking the medicine. So this patient is coming. When the patient is coming indirectly from other, whether be allopathy or whether homeopathy, because you have to get the clear picture before taking the earlier medicine. They have to symptom we have to collect, these symptoms we have to collect, and after that allopathic medicine or homeopathic medicines, if it come from the homeopathy, that have to be taken out, that have to be taken. So 91 aphorisms, and also in some conditions, because acute condition, this is 91 aphorisms, and 92 acute condition, and 91 acute condition. When there is acute condition, patient, I am taking the allopathy medicine for a long time. You please do something. You please do something. I am taking from the homeopathy medicine for a prolonged period of time. Please do something. Do something. In such condition, acute diseases which are of rapid character, we have to give the medicine on that circumstances, on those present situations. Now, in this context, and this is the 92. Do not like to read out because it is unnecessary reading out. Now, actually, we make false practice में जो हम लोग क्या the procedure of treatment of chronic disease, it is written in 206 and 209. If you go to the 200, 206, Hahnemann has clearly stated what had to be necessary in order to know the proceeding of the chronic disease, in order to find the whole history of the chronic disease, to enable to discover the fundamental cause, as we have studied in the paragraph number, aphorism number 5. Why it is necessary to inquire about the previous allopathic treatment? Hahnemann himself quoted it. Himself said, because in order to get the clear picture before the treatment and after the treatment. Now, when above information has been collected, that is written just 2007, it is not quoting. What is the learning? What is the learning from? What is the learning? Learning is that history of the previous allopathic treatment is necessary to inquire about in order to know their effects in causing deviation from the original state of the disease, so that it may be corrected or possible and harmful medicine avoided in futures. Yes, it is wrongly typed. So it is a learning from the 207. So why? Because in order to get the clear picture, we have to know even today to what decision you have taken, whether it is allopathy, which allopathy medicine. That is helpful, because what sorts of side effects, steroids, antibiotics, others, that you have to know, you have to understand that, and therefore you can confuse her. But one thing we should know, what Master Hahnemann said, that what beneficent deity granted us of homeopathy in aphorism number 74, 75, 76, he stated the first sentence that only the natural disease Almighty deity gifted us homeopathy, but not for the artificial disease only for the natural disease. But we have to, later on, so many persons developed it. Hahnemann also said that treatment should be done under the vital force itself. Vital force, it can be remedied, but when there is a devastation, when there is a maiming, when there is a permanent change, there is a scopes. Later on, so many persons, stalwarts developed it. Now, steps of treatment of iatrogenic disease, very, very much important to understand. What are the steps? Iatrogenic disease. That iatrogenic disease I am discussing, obviously that patient is coming by taking the wonder drugs. That means the drug allopathic wonder drugs. This treatment is about the side effects of the dangerous characters must be remediated by vital force itself with proper anti-miasmatic treatment by medication. That is written in the 76. लेकिन तो vital force ऐसे स्थिति हो गया, the condition of the vital force studies cannot remediate itself because it may be disturbed by the bad effects of these wonder drugs, and ultimately we need some help. Vital force cannot, because vital force with the help of medicine remove the disease, because vital force cannot. We know that vital force needs a support. So this detailed case taking, first you have to take the case taking and to find out the drug which is responsible for the condition, and thereafter we can antidote it by totopathic medicine. Something new I am telling to you, that I do not know, I know that you have studied the totopathic medicine. We have spoke to do totopathic medicine. May apply the same drug in the same drug in that condition, same drug, and that same drug may on, if such potentized totopathic medicine not available, because we may apply drugs in a Nagpur and camphor as antidote, universal antidote. Please remember one thing. You please remember. You please that autopathy. If the patient is coming from the streptococcus, if the patient is coming by taking the long use of the chloramphenicol, long use of the steroids, long use of the antibiotics, we have the scope. I do not know the available, but that so many autopathic medicines are available. They have good scope for antidoting, for good scope for lessening the that condition arising after the use of the allopathic drugs, or also the wonder drugs. Even the penicillin also available with us. So even but in certain condition, because the Nagpur and camphor as antidote, my students, that should be thought, that should be pondered, because of that what Hahnemann told earlier, that Nagpur and camphor sometimes, most of the times, fails antidote wonder drugs. Now the wonder drugs. What Hahnemann told earlier, at that time wonder drugs were not available. At the repressive drugs are available. So Hahnemann clinically observed it and mentioned in the Mathematica, if a physician prescribes on totality of the symptom without considering the bad effects of the drug, this is the previous medication, he fails surely. So we have to consider both the totality of the symptom, that means natural disease, the symptomatology, with the artificial drug. Even he discriminates symptom by one drug disease and natural disease, he cannot find two antidotes at once at the bad effects of the. So therefore, this universal use of the Nagpur and camphor sometimes fails. So we have to scope the totopathic medicine in these such conditions. We can take the scope of the totopathic. My subject, my topic, this part is the totopathic treatment we should think of, and I have some cases by treating the totopathic conditions. Now the totopathy, because J.M. Kanjula is a renowned, it was the founder of the Homeopathy Medical Association. As you know, J.M. Kanjula was a teacher of my college earlier, where I was in administration for a prolonged period of time. And totopathy is indirect homeopathy. It is homeopathy a minus actual quivering of the drugs on healthy prover. It is used in the basis of so removal of this iatrogenic condition. We have a good weapon by the use of totopathic medicines. But the same medicine, same IDM medicine can be used for the purpose of treating the conditions. Positive effect of the side effects of the abused drugs. They are used on the basis of the symptom produced by the crude drugs. They are prepared strictly by the process of the homeopathic pharmaceutical. They are used in potencies. This core information given by the J.M. Kanjula. J.M. Kanjula is a good practitioner. He observed so many factors. He has good literature contribution in the academy. There are a lot of persons I know in my life, because few persons have some contribution in the academy. He has lot of contribution in the academy. Another great personality I can quote here. At this point, I want to warn my readers, and not the least, and I want to go away from the homeopathic principle, but just I want to remove some obstacles to recovery, and remove such just two obstacles to recovery, in case of this modern wonder drugs era. Totopathy cannot be. It is not my saying. It is a saying of another great personality, Dr. Patel. Just few years back, 1 year or 2 years back, he died. He left us. Once I met with him, because I am the product of Calcutta Homeopathy Medical College. I was the president of this alumni association, and owing to that, in last year, probably 1 year back, we celebrate and we awarded him from our association lifetime achievement. I've gone through these books. Please you read out, because we have time is very few, and therefore I am just concising out the time, and just because I am winding my lecture, because totopathy have a lot of scope to contribute in homeopathic practice to removal or antidoting the effects produced by the allopathic wonder drugs. So procedure of taken when patient comes from a pseudo homeopath. Just what I have told, that is from the allopath getting the. But pseudo homeopath means that homeopath is not following the claiming I am homeopath, but not following the semi-monomany. Only the person who follows the semi-monomany, the principles of homeopathy, he can be claims in homeopathy. Otherwise, if he sometimes gives him other tinctures, sometimes gives him the combination of drugs, sometimes gives others, I am not criticizing any persons. But being an academician, being a practitioner, being a institutional persons, when we are imparting teaching the students, we should follow the literature written by Master Hahnemann, accepted by the academy, by Central Council of Homeopathy. So which is not included in the Central Council of Homeopathy and introduced in the academy, that can be told as pseudo-homeopath. So when the Central Council of Homeopathy accepted them and introduced them or practice and in the academy, then I will. But till now, in my version, in my knowledge, in my, I can say, and you obviously, you the student, you should know this, they are the pseudo-homeopaths. And what to do? When the patient comes from a homeopath who tries to follow sine, but anyhow he fails, he had the prescription and patient as a ethics, because he never follow, hand over the prescription. Some person they give the prescription, some persons that do not give the prescription. So what ethics says? Ethics says that every doctor should prescribe and the prescription should be handed over. But maximum the homeopath, they do not prescribe. They give their own couriers and to lot of sugar and milk, but a code name are written. But prescription should be handed over. Now it is mandatory for the ethical point of view by the government of India. Careful note down symptom and are present before them. Some doctors gave careful case taking and everything handed over the patients. At least I saw in my life, so many doctors are there. In that cases, maybe it's coming from that homeopathic at that first time, and in just only give on only placebo at the first point of time. Just in earlier cases, I told you, in case of artificial chronic disease, just you the vital force will be remediated by it. At that point only you can give the placebo. 74, 75, 76. Next, after acquiring the complete knowledge of the polycrase remedy, you can then give first. So you may end that antidote it either by homeopathy, either by anything, and then give the any other medicines. Next, now the procedure of treatment of the patient with mammings and devastation, a patient with one kidney, a patient with one lobe of the liver, patient with one lobe, cyst, hydatid cyst. I have seen a case of the hydatid cyst treated by homeopathy. Nicely, hydatid cyst, and allopathy person advised them to lobectomy, but ultimately cured by homeopathy. If I get time, I will state the case. But for the side effects of the dangerous effect, Hahnemann himself said that in the approximate 75 last part, there is no the vital force should remediate. Should be remediated by the vital force treatment. There is a warning as given by Master Hahnemann. Human healing art for the restoration of the normal state of health, innumerable abnormal condition produced by the repressing drugs. Now come wonder drugs. And there is no, that cannot be. But in spite of that, we have approached by applying the antidote, by applying the autopathic medicines. Now, can you able to present days following mamming produced by the kidney failure, pancreas damage, heart failure, liver damage, drug-induced cancers, lung damage? Obviously not, because of that we have little scope when there is a one kidney. But there is a procedure of treatment by which you can, how? We have to assess the curability, incurability. By the process, the curability, immunity. Assessment by the curability, immunity. When the gross change or no question of diversity, by observation of the action of the currently chosen remedy, if it acts, if it will give some reliefs, no doubt relief. So the curability and incurability of the cases can be observed by application of the medicine on that condition. If it gaps, we do not know the vitality of the patient. Even the allopathic doctors and the surgeon giving an advice to operate. But ultimately, when he came to the homeopathy, there are so many cases. So even after administration of the selected remedy, if the homeopathic aggravation continues for a prolonged period of time, by the Kane's observations, but the cure is incurable. And just after administration of the remedy, if there is a very much quick amelioration, these are the indication parameter by which we can diagnose what is curability and incurability. Next question is, after the administration, well-selected remedy, the patient, and sometimes what when found, it is satisfaction again, not satisfaction, that another observation of the Kane, it is going to the removal of the one kidney others. So by which we can help the curability, incurability. After administration of the disease, and the symptoms follow the rule opposite to hearing loss, so case is incurable. By which in cases, so certain condition required only palliation, and so in such condition, what to do? Only to palliate, only to homeopathic palliation. Advanced in after the wonder drug, after the allopathic drugs, there are the advanced changes. You can't do nothing. There is no scope, little scope to do. Only to palliate, only to palliate, only to palliate. Lacking of vital organs. Just I have stated that after taking allopathic medicine prolonged, there is cirrhosis of liver. One lobectomy is indicated. Hydrolysis of the lung, lobectomy is indicated. And in some cases, the relief of the pain agony of the death, incurable death, advanced case of cancer. In these cases, we have to do the palliation. So today, just we have discussed the procedure of treatment of the wonder drug, the repressive drug, a lot of wonder drug, what Heyman studied organ medicine, they have been changed wonder drug, and that wonder drug have a lot of scopes. Because we do not use what Heyman studied in organ medicine, as I have already first slide I have showed that what doesn't told, what Heyman told earlier, that was very much particular. But now today it has been changed, and I do not like to denunciation was done. I do not like to criticize it. Dajan himself told, I do not like to criticize the Heyman statement. Now, this is about the last case 1, case 2. There is case 2, totopathic medicine. That is a case at OPD, and just one. Hello. A lady just hurriedly I'm going, and 35, age 35 at OPD when I posted at the health center. And first part of life in the year 1989, I joined in the job 88 through Public Service Commission. Severe vertigo, at last 7 days, aggravated by slight motion, buzzing sound, and just that OPD was so much crowded. On that basis, I bound to prescribe some medicine because you had a little scope to do the exhaustive case taking, and it is an acute case. And ultimately, what I advise on that basis, Briannia, and advise to rest and take plenty just on that basis. Just a Briannia, yes. After that, the second week, she reported after 14 days stated she was very good. She was eager to get relief, but no improvement is there. Again, what I thought on inquiry, because at that first stage, I did not get time because of the outdoor was so crowded, and therefore he told that she was taking, she told that she was taking, and because having some problem of the TB, acute tuberculosis, was streptomycin was taking. Streptomycin is taking, and allopathy doctor has given vitamin, etc. Ultimately, he saw the prescription, and streptomycin 200 I prescribed and advised to take, because I had some idea about the totopathic medicine, and because I had contact with some doctors, and the totopathic medicines are available so many shops. In order to remove that obstacles, I prescribed the streptomycin only, because the patient was taking streptomycin for a prolonged period of time, and the acute stage of tuberculosis was removed, ultimately suffering from side effects. Third visit, I attended 20 hours later on, but anorexia is there, nausea, query, why are you coming after 30 days? She told that because I'm good better, no vertigo, no dizziness, मेरे से कुछ प्रॉब्लम नहीं है, आंखों में देख सकता है, देखो नहीं है, लेकिन मेरे खाना नहीं ठीक से हुआ है. I thought medicine is acting, streptomycin is acting, but Briannia did not act, and therefore I gave the nihilinam and placebo nutritious diet, because it is acute case, so no need of details case taking, but just to I to show the effect of the totopathic medicine in order to obstacles of recovery in the form of antidoting that situation. Sometimes it cures, that the condition is removed. Whether it is condition, it needs under mycenatic treatment, and for the removal of these tubercular impressions and tuberculosis. But at that point, it is cured. Another case I saw attended in the non-lung health center. It is near to Bartha. Loose stool diarrhea was passes stool and like a jet. जैसे डॉक्टर मेरे जो टट्टी हो रहा है, जस्ट आई एम कमिंग लाइक ए जेट, जैसे लाइक ए हेन, मुर्गा जैसे टट्टी जाता है ऐसे जाता है. By stool we can differentiate one medicine to other medicine. So general weakness is there. And on that basis, OPD is quite difficult to hard to take the case exhaustively. On that basis, snapshot prescription हो जाता है. Acrotentic 34 placebo report after 2 days. And thereafter, next visit he came with his mother. The patient Robi came with his mother after 3 days, reported no improvement. Doctors कुछ फायदा नहीं हुआ है, and therefore and then again inquired his mother. He had some ear trouble with the past few days back, and in the same campus there was allopathic unit, and took the chloromphenical medicine for that chloromphenical. And now the chloromphenical is back, but at that time chloromphenical is very much. Now the 8th or 10th generation antibiotics is going on. I prescribed chloromphenical 200 on that basis only, because I have some curiosity to work with this totopathic medicine. As medicine was not available, I advised him to Bardhavan, because Bardhavan to nearest, and ultimately I have contact with that manufacturing that shop. Please contact anybody from Calcutta to bring the medicine. Ultimately, they supply the medicine to the patient. The medicine took the medicines. And the patient, the Robi attendant, after 1 month and procures outside medicine and stool, but weakness is there. He told that my stool is quite okay, doctor. Lekin the weakness, okay. Advice nihilinum and 200, and thereafter, and just my conclusion is that because I am giving emphasis, why and the Nasvomica, why and the other drugs are very much effective from that repressive drugs. Now we have to do some research on the point of protopathic drugs in the form of chloramphenicol, in the form of steroids, in the form of other antibiotics, and that can become, because of the poisonous effects of any medicine, can be antidoted by higher medicine, because we have some literature we have with us. So with this vision, I given because of some ideas earlier in my practice and also in my student life, and therefore I protopathy to give antidote and give relief after that bad effects of wonder drugs. With these views, with these few words, I would like to thank to all of you, and I request to all of you, please stand up. Zehra ma'am, please stand up, don't sit down, stand up, stand up. सभी लोग खड़ा हो जाइए, सभी लोग खड़ा हो जाइए. मैं जो लोग, those who are sitting in the chair, those who are here, 77 viewers are there, don't sit down in the chair, please खड़ा हो जाइए. यहाँ पे नेशनल एंथम है. जनगण मन अधिनायक, जय हे भारत भाग्य विधाता, पंजाब सिंधु गुजरात मराठा द्राविड़ उत्कल बंग, Bingo Himachal. Sound is not coming because sound is also incorporated. I do not know. Jessica has started the sound. Uchala Jalajitaranga, Subo Name, Jage, Tabu Subo Name, Aise Mange, Gahi, Tabu Jagatha, Janagana, Mangala Jai, Bharat Bhagya Vidhata, Jai, 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 Jai. My viewers, because I have told them, I have just presented this my literature. Every academy has two scope, for the student purpose and for the community. What homeopathy can do for the community. What just I have presented, not for my students alone, also for the community or for these nations, because only the India has lot of scope to do the research of the homeopathy. So I praise my countrymen, I praise my India by singing this national anthem, and therefore I asked all my viewers, those who are just viewing this vocation, to stand up, and with these views I wind up my lecture. Thank you, Jessica. Are you here? Hello, Jessica, are you here, or I will continue?
Yes.
Yes, sir. Thank you so much. Hello.
Yes.
Thank you so much. Sorry, वो 1 minute मेरा call आया था, तो I was on call. Yeah. So, sir, can we start with the question answer session? Ready. Sure, sir. Thank you so much. We have a question from Dr. Shabnam. Why you have given Calcaria Carb 1M BD for several days in RA case? Can we repeat 1M frequently?
Yes, Dr. Shabnam, we can repeat 1M frequently because 1M acts very well on connective tissue and bone disorders. If you'll give 30 potency, there will be no change in the patient's symptom. So if you'll go for higher potency, not too higher, but it should be 1M. So it will give much relief. That's why 1M was given.
Thank you, ma'am. Dr. Tejas wants to know how about giving manganum in osteoarthritis cases?
Yes. Can you pardon, please?
How about giving manganum in osteoarthritis cases?
Yes, it's also a very good remedy. You can give when we will see osteomalacia along with arthritis. It can be given in that cases.
Thank you, ma'am. There is a question. I request the audience, by the time we discuss questions, if you have any queries, please post in the chat box. Ma'am, Dr. Neetu, Dr. Neetu wants to know any palliative medicine when there are severe deformities.
Hello, tell me again. It is my question.
It's my
Yes, sir. Any palliative medicine when there are severe deformities?
Deformities. Which deformities? Deformities of what? Any part, particular part, or entire body? Deformities of any part?
Sir, any deformity like we can consider arthritis or
That deformity is owing to the iatrogenic disease or owing to the natural miasmatic disease.
so I think shayad iatrogenic diseases because your topic was iatrogenic.
If it is due to iatrogenic disease, we have scope. If it is miasmatic disease, miasmatic disorders, natural miasmatic disorders, we have scope. Yeah, we have scope. There is no particular medicine in consult. What medicine he has taken or she has taken, that should be considered. And on that point, first we antidote the medicine. If the deformity is a permanent, and what Hahnemann says, that if it is deformity is only the palliative treatment and just to relieve the pain, and the prolongation of the span of the life, nothing else. Because of that, the normalcy will not. It is a permanent change. There is a structural change. How it will come? Hahnemann himself will know there is no scope. Because we can only the prolongation of the life, the span, duration of the life can spend, and the pain and other forms, the deformity cannot be terms. If it is the polio, the post-polio paralysis, that deformity, as I say, the post-polio paralysis. If you continue the homeopathic treatment, there is a chance. Depends on the vitality, but that depends on so many conditions. Okay, any question?
There is a question for ma'am. If we find all the symptoms of Calcaria carb in a patient, but heat from palms and soles is not there, can we still prescribe Calcaria carb?
Yes, we can prescribe Calcaria Carb when all the symptoms are pointing, because we cannot conclude selection of a remedy from single rare symptom. You can freely prescribe it because majority symptoms are pointing towards Calcaria Carb.
Thank you so much, ma'am. Which remedy? I think this is a question for sir. Which medicine can be used for extreme dryness of skin?
Extreme dryness of him due to the natural miasmatic condition or as due to steroid group of drugs. Which one?
Steroid group. Yes, sir. Yes, sir.
Steroid group drugs. So indicate after removal of that steroid effect, if the patient remains without medicine for the time being, normally if do not returns after stoppage of that cream, any drugs, then we think of any medicine. Otherwise, if normally she comes after the withdrawal of that steroid drugs, just at that first point you only give the placebo and continue with placebo. After giving a certain period of time, no, it is not coming into normal. Naturally, the dryness is produced by the steroid drugs and whatever maybe thing, it comes to return after withdrawal of the drugs. Only placebo is the good medicine at that point. There's no need of medicine. But if not comes, if it is remaining with the for the prolonged term, then we think of, because I have told you the two group of patient may come. One group that it needs immediate medicine, acute condition. Considering that situation, you may think of any medicine. If the dryness is continuing, the sulfur may come. So there are so many medicines. Commonly we think of the sulfur because some sulfur is most common in medicines. If the dryness is more, skin is theirs, and then any other medicines may come, fegofirium may comes, arsenic may comes. So many medicines. So depending on the situations, considering the situation produced by the medicine, commonly steroid drugs. Okay, there's a lot of medicines. First, placebo is the good medicine, and let the vital force remove the effect of the. If the vital force fails to remove, then give the one medicine. Otherwise, no need of medicine. Because no permanent devastation is there. Right. Next.
Thank you, sir. There is a question from Dr. Nabila. What is the cause of severe hair fall lasting since 2 to 3 years, and what homeopathic remedies can be used?
Hair fall is due to what? It is a natural miasmatic impression, naturally or using by hair oil and others. हेयर फॉल में भी 2 टाइप्स. हेयर फॉल कुछ नेचुरली होता है ड्यू टू बैड इफेक्ट्स ऑफ कुछ आफ्टर इफेक्ट ऑफ द एलोपैथिक ड्रग्स, जस्ट मेडिसिन स्टेरॉइड्स. So there is no specific medicines. So many medicines are there. Hair fall, you may think of, because hair fall you indicated is the syphilitic miasm. Symptomatic treatment can be done, but SORA is also there because it's multi-miasmatic. So SORA is there, but don't use any specific. I can't say there are a lot. If you open the repertory, you will get a lot of medicines are there. Can I say it is justifiable to name one medicine? I can say if it is a miasmatic in features. So first let the miasmatic action brought forward and take the case and give the medicines. And mostly what happened, it is syphilitic nature. Syphilina may comes. Syphilina mostly comes because you think of the background, mausative background, but sometimes SORA is predominant. If the SORA symptom along with the hair fall, if their other symptoms are prominent, and that corroborates with the SORA, then you should follow the approach of treatment of the chronic diseases by following the organon of medicine and also following the repertory and mathematica. So mostly hair fall, we see that it goes to the syphilitic miasm. So you consider the anti-syphilitic medicines at first, but it will not be rational. Considering the miasm, predominance miasm, any medicine may come. Okay.
Thank you, sir. Please refresh your page. I think we are not able to see you. Please join again. By the time, ma'am, let's discuss one more question. Why did you select Calcaria Carb in RA case? Maybe it's because what is the cause behind it? What is the reason that you've selected?
The selection was on totality of symptoms. Totality of symptoms pointed directly towards Calcaria Carb. So Calcaria Carb was selected, and constitutionally also the lady was totally Calcaria Carb.
Thank you, ma'am. Sir, Dr. Vidhi wants to know, for keloid formation, surgery should be done or our homeopathic medicine will work?
Homeopathy medicine is better. I have one case in Nagpur. I have one case at Nagpur. He's a PhD in physics, attached to the NIT Nagpur, come from South India. He rang me a few years back. I gave him graphitis and improved. By totality of the symptom, I gave him graphitis, and suddenly he stopped the medicines. He did not contact with me because he went to his native places and some ritual was there due to some mishaps over there, and came back, and suddenly during long-term phone, he telephoned me, sir, this is the problem again. After giving your medicine, after applying your medicine, I got relief. So, but keloid is such a thing that it takes more times. But at least, but he told, sir, doctor, when I used some topical application at the time, I did relief, but again it returns again and again. But what I saw after giving that graphitis, your medicine, since that time, just I rang back 15. I gave him medicine just 6 months before. At that time, during that period, he did not apply any cream. I just apply him. Just you can use the coconut oil if you need irritation others, and clean. You please clean every day. Clean every day and that part. And every day. So I think keloid, if you go to the surgery, I have seen so many cases, it recurs. We have treated with the homeopathic medicine that it never required further surgery. So I homeopathy, better homeopathy, who follows the rational homeopathy, single medicine like Zehra ma'am, they should contact with them in the Nagpur and others, and please go through the homeopathy first and last.
Thank you, sir. Ma'am, there was a question for you from Dr. Tejas. How about giving mother tinctures in cases of osteoarthritis and rheumatoid arthritis?
You can opt for mother tinctures in cases of osteoarthritis and rheumatoid arthritis. But I think if we'll be going in for dilutions, that will be better than the mother tincture, because as mother tinctures are prepared from crude substances, they can sometimes aggravate the disease. So it will be risky to give mother tinctures.
Palliative treatment only.
Thank you, ma'am. So please refresh your page again. You left.
Why? Net problem.
Net issue, sir. Yes, sir. Net issue. You can refresh. You will join again. Ma'am, there is a question from Priyanka, Dr. Priyanka. For osteophytes, which are good medicines and favorable potencies?
Yes, for osteophytes, we have very good medicines like Calcaria Fleur, Calcaria Phos, Calcaria Carb can also be given. And one thing I want to tell, that in cases of bony tissue disorders and connective tissue disorders, you should opt for higher potency. So you should preferably go for 1 M potency. Okay.
Thank you, ma'am. Sir, Dr. Uma wants to know any homeopathic application for keloid.
Homeopathy application, topical application or internal application?
Sir, I think topical application she wants to know.
Homeopathic topical application, no. I say no. I say no.
Thank you, sir. Thank you. Which
No
medicine?
need. Just I have told you, no need of just you can use the coconut oil, simple better coconut oil, and follow the homeopathic medicine. No need of prophytis ointment, no need of sulfur ointment marketly available. These are pseudo homeopathic approach. Since we are organizing webinar for the academic interest, for the professional interest, so we being academician, we should give emphasis to our literature and the principles. चोरी पुलिस ट्रेनिंग स्कूल में चोरी नहीं सिखाया जाता है, लेकिन वो भी पुलिस को कभी कभी चोरी होता है, लेकिन क्यों? So sometimes our friends follow such type of treatments due to what? Due to the lacuna in the knowledge of practice following the organon medicine. Only the lacuna is the organon medicine and metromedica. So I say that sort of topical application should not be applied even in the name of homeopathy. It is irrational, antagonistic to homeopathic principles. Just you go through the organon of medicines, one-sided disease and the other part external remedies. Next, any madam?
Yes, sir. I request both of you to please type in your email ID for the participants to interact with you if they want to interact or ask any questions, or they are left with the questions. By the time, ma'am, there is a question: can homeopathy dissolve calcaneal spur?
होम्योपैथी रेमेडी, गुड होम्योपैथी रेमेडी, कैल्केनियन स्पर बहुत अच्छा रेमेडी है.
Yes, sir. Yes, sir. Sir, please अपना email ID, मैम अपना email ID टाइप कर दीजिए.
Yes, ma'am.
सर आपको फिर से शायद रिफ्रेश करना पड़ेगा पेज.
और कहाँ पे है रिफ्रेश?
यस सर, एक बार रिफ्रेश करिए. Thank you so much, ma'am. Thank you so much. Let's join then. Ma'am, which medicine can be used to get rid of joint pain?
Many medicines. There are n number of medicines. We can give Calcaria Carb, we can give Calcaria Phos, Arnica, Restox, we can give Colophyllum, Causticum, we can give Bryonia, then we can give Thuja. N number of medicines can be given for joint pains. And if it's only just inflammation, that will be very well cured with belladonna. Belladonna is also very good remedy for joint pains. inflamed joint pain, inflamed joints.
Thank you, ma'am. Sir, please type in your email ID in the chat box.
Where is the chat box? Okay.
Sir, third point. Please see the third option.
Okay.
Yes, sir. And now, on behalf of the whole team of Homeopathy 360 as well as BJN, I want to personally thank you, both of you, ma'am, Dr. Zehra, ma'am, and Dr. Akhilesh, sir, for being with us today and guiding us so beautifully about both the topics. We had a great session, great knowledgeable session. I hope everybody enjoyed with us. And thank you, the patient audience, for patiently listening to the webinar as well as being with us for the whole webinar. And tomorrow we are having again a webinar of Dr. Ravi from Lucknow, who will be discussing on the use of hair therapy in dealing with homeopathic medicine, homeopathic cases, or clinical cases in hand. So that is a very innovative topic, and I hope everybody will join us tomorrow again. And we'll continue the day 4 of this webinar series. And thank you so much, both of you, ma'am. And I hope to see everyone tomorrow again. And thank you so much. For any queries, you can mail us at webinar@homeopathy360.com for the certificate, and the quiz link you will get on 18th of July when this webinar series will end. So you'll get on your mails about the quiz as well as the certificate link. So thank you so much, everybody. Thank you, sir. Thank you, ma'am. For any queries, please mail me at webinar@homeopathy360.com. For speakers, you can contact Dr. Akhilesh sir at akhileshkhan@gmail.com. And to contact ma'am, you can mail at drhuckzehra@gmail.com. This is in your chat box. So thank you so much, everybody, for being with us. Thank you, ma'am. Thank you, sir.
Welcome, Yashka ma'am. I want to say something.
Yes, ma'am.
I want to say something.
Yes, ma'am. You can. Yes.
I like your comparing very much.
Oh, thank you so much, ma'am. Thank you for the compliment. Thank you so much, ma'am.
You're a good moderator.
Thank you. Thank you for the compliment. Thank you so much. So I think I can end the event, ma'am, sir.
A good applause for you.
Thank you. Thank you so much, sir. Thank you, ma'am. Both of you. So thank you, audience.
Thank you, my viewers.
Bye, ma'am. Bye, ma'am. Bye, sir. Thank you. Thank you, everyone.